assessment, I would say every patient that comes into the office, I have them squat just to kind of see. It gets overwhelming because you can look at foot, ankle, knee, hamstrings, everything all the way up the chain. We want to make sure that you guys are just understanding how to be applying this, because this is a move that pretty much everybody should be able to do well. And in my opinion, if you can't do a full depth squat on command, there's some serious movement pathology. It might be structural, but it's more than likely functional. So everyone in the room should be able to drop down into a squat and stand up with no trouble, which is not easy, right? And prior to DNS, I couldn't do this. So it wasn't until I learned to stabilize right that I was able to get these super awesome disc herniators off. Okay, so when we're doing this, you're going to have the feet are going to be shoulder width apart. To put a stop to it, no, they should not be parallel. Okay, they shouldn't be parallel because back to what I was talking about before, the actual creepy pelvis. Is it over there? That's fantastic. Anyways, so the orientation of the acetabulum is actually such that if you have your feet parallel, you're actually tightening the capsule, but it's out of position. It's not really centrated when you do this. The closer your feet are together, the more internal rotation, or the more towards neutral you should be. The more abducted you are, the more externally rotated you need to be. Okay? So this is my favorite thing to do when I present. Has anyone ever seen Bloodsport or does know who Jean-Claude Van Damme is? Anytime I can get Jean-Claude Van Damme in a presentation, I'm going to. What is Jean-Claude's move?
Splits.
Splits, yeah, he's meditating. He's got his legs in a full hawk split. What position are his feet? Are they pointing towards the floor or are they pointing up towards the ceiling?
Ceiling.
What is that at the hip?
External rotation.
Maximal external rotation. No one is physically capable of internally rotating their femurs and being out there. The shape of the hip itself doesn't allow it. So the wider your squat stance, the more externally rotated your hips have to be. Now, people always say like, oh, my foot's externally rotated. No, your foot's neutral. It's externally oriented. It's the hip that's doing the motion. So if we're doing a back squat and I'm here, then I'm going to have a little bit of external rotation. If I'm going to do a low bar back squat, this is going to cause incredible amounts of torsion at the knee because I have to externally rotate that. The capsule, the hip, is forcing the femur into external rotation here to do my low bar back squat, and I don't have the external rotation range of motion in the ankle to keep the tibia with the femur. So that turns into, man, I wish I had that thing. That turns into the femur externally rotates and torsions the knee, and now you have this horrible force going through the knee. So you need to turn the feet out so that when I do a low bar back squat, I can keep the knee in a good position. And instead, I'll just chew the hip up, which is what happens with a low bar back squat. Anyways, so when we're doing just a normal squat as a test, you want them about shoulder width apart with a little bit of external rotation for the simple reason that they need space for their pelvis to go between. And that's sort of normal, natural development. So feet are going to be shoulder width apart. When I'm having them test, I just have them squat. I want to see what do they do. So go ahead and squat. Not bad. Go ahead and come back up. So we see a little bit of a butt wink here. Is a butt wink natural or is it pathological?
Natural.
Well, it's not good if you're loaded, right? But we should have about 110 to 120 degrees of hip flexion, which means a full depth buried squat is going to have some of a butt wink there. And if you watch a baby or someone from China or Indonesia that just sits like this, unless they're absolute genetic anomalies, they're going to round their back over a little bit. Because as I squat down here, flex, 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 I'm right about at 120. I don't have any more range of motion. And and so I just need to round over. This position is healthy. The reason that I like this position is because to get into this position, I have to be able to shut my back off. If I have, before, when I was training, just squatting a ton and trying to be, a good athlete, I couldn't turn these off. So I would get to here, and then you'd see my toes would come up, and I feel like I'm rocking backwards. Or I could push my knees way forward. So I needed Olympic lifting shoes because I could not shut my back off. So when I get to here, this is healthy that I can let my back relax and open up and round over in an unloaded setting and sit like this. So this is incredibly healthy to be able to do this. All right, so butt wink is okay, unloaded, and it's natural in a normal full depth squat. So let's see if we can see where he does the same. Okay, go ahead. So right about parallel-ish, right? Let's go ahead and come back up. And that's normal. It looks controlled. That's good. The other thing that we can look at, if we're watching the feet, if you just tell them to move their feet out and you watch what they do, in general, they're going to externally rotate the leg that tends to be more unstable. So if you look here, I don't know if it was necessarily intentional, but he's turned this one out more. And if we look here, he's got more of a loss of position here. So he's got a little bit more collapsing. He's got that subtalar joints a little bit more everted. And then we work up the chain, so now he's externally rotated this. I'll have them jump in place 3 times and stop and not move their feet. And usually the foot that's the hip that's more unstable turns out more, if that makes any sense. Okay? So we want to watch the foot loading. The foot loading that Collage describes makes learning how to squat in Olympic lifts very, very easy. If you do what most people do in weightlifting now, that is load the heel. We got to load the heel, right? Load the heel, and then now CrossFit has you pushing the knees as far out to the side as possible, right? So this is literally the position that some of these guys are in. We obviously don't want that. We need to have support on the base of the big toe, the little toe, and the heel. When he's squatting and he's going down, the medial arch is going to work with the hip, the external rotators, to control the position. If you think of the talus and the tibias here, if this foot collapses, that's going to drive the tibia basically into valgus and internal rotation. Well, we need it to be an external rotation. So the support here is really important because it's going to raise up the arch, and that's going to move the talus into position so that the tibia can maintain that proper position. The other thing is that the flexor hallucis longus, this is easily top 5 coolest things in the body. The flexor hallucis longus goes underneath this cool little shelf called the sustenaculum tali, and that has a shelf that this tendon goes through. So this muscle comes from the big toe around the back, and then most people think it comes up and attaches to the tibia. It doesn't. It crosses over and comes up the fibula, which is very clinically relevant because that motion with a properly loaded foot, your flexor hallucis longus is going to create external rotation of the tibia. And because of that awesome sustenaculum tali, when it gets good loading on the base of the big toe and activates, it's going to pull the sustenaculum tali up, which inverts the calcaneus. So this is, they don't talk about this in windlass effective Hicks, but I think this is a bigger factor than the actual fascia. But that's why we need this loading, because we need this arch active to use the flexor hallucis longus to bring the foot into position, to bring the talus into position, to bring the tibia into position, so that now the knee is controlled. So it's almost like the foot is pushing the knee into position and the hip is pulling it into position. So they work together, as opposed to if he sits back on his heels and pushes his knees out. In this position, he's balancing on his heel. He has no contribution from the stability in the foot. So he's doing only a top-down stabilization strategy as opposed to both meeting in the middle. Does that make sense? So when you're watching the foot loading and you watch him squat, he'll probably do it fine. You want to make sure that you actually see the metatarsals splay out a little bit. You want to see that he's maintaining this loading here. Go ahead and come back up. On an interesting note, the DNS weightlifting class I taught, I happen to have the best powerlifter in world history there, Donnie Thompson. He's a 1,265-pound back squatter, which ain't bad. He intuitively figured out, does anyone know what a monolift is?
Mm-hmm.
Yes?
Yes.
It's the coolest item in the weight room, period. It is a squat rack where you have the bar there, you get set, you lift up, and then the rack moves away from you. So for me, as someone who's been trying to apply DNS to weightlifting for a long time, what information can I get out of that?
Where they set up, how they set up.
Yes, the shortest in between 2 points is a straight line. They want that bar to go straight down and straight up, which it means I got to ask Donnie Thompson, Donnie, where do you line your foot up with the bar? He wants the bar right here. That's exactly consistent with what we talk about. It's really cool because he knows nothing about neurology and everything else, and I refer to his squat rack as his laboratory. If it doesn't work in the monolift, he moves on to something better. But over the course of 10 years, he figured out that he needs to have this loading right in front of his ankle. So the bar's right there, so that as he squats, he's getting full foot loading. He also said he wants to feel his foot crush open. And he rolls his foot out to decrease some of the hypertonicity in the foot, because he wants to feel as much in his foot as possible. He thins his shoes out, because you have to have rubber shoes on because of the friction stuff. He thins them out and sprays Loctite in the shoes so that his foot is locked in the